I'm Jody Bracy. I am the veteran advocate with IGY6, and I'm here today to support your opposition to closing the VA clinics. I would also like to encourage you to stay on top of it and encourage us to get more help for our veterans down here. I am going to use myself for an example. I have a consult in for a community care chiropractic consult. It's been over a month. Do you think I've heard from the VA? No. Do you think we have enough health care in this valley? No. Since Dr. Archuleta died, my sole source of health care is the VA. And with the last provider we had here at the local VA clinic, Dr. Bateman, I had to go to bat for a veteran who has chronic nasal inflammatory disease. Dr. Bateman thought he was going to get the COVID cooties over telehealth. He wasn't even in the same building. This veteran has had this issue for a long time, like ever since he got out of the Navy in 14. And this veteran was refused treatment by Dr. Bateman. I sent several letters, including from another veteran who Dr. Bateman refused to discuss this veteran's diabetes with him. And all they have done is reshuffle this doctor around. So that the doctor didn't want to see us anymore, so we had to now we have to travel once a year and go see Dr. Means, which by the way, I love, but he's in Burlington. That's on the Kansas state line. If they do ever get these 3 clinics closed, which I have heard rumors that they're trying to decommission the Heirs Commission. If they ever do close these clinics, which we were promised they weren't when they closed Fort Lyon, you will have veterans on both sides of the Kansas-Colorado border, clear to I-25, who will not have access to VA healthcare. And the VA is not forthcoming in what they're telling you. They are being less than honest. I would consider them extremely truth challenged. And I am hoping that this commission, or my commissioners here, will continue to fight for us veterans. I know I'm kind of the loudmouth in the community when it comes to fighting for our veterans, and I enjoy doing it. But I want to make sure you guys understand the need for our VA clinics, because they want us to have 1,000 people enrolled in VA healthcare or more per clinic. It's kind of hard to do when you can't even get an appointment up here. I asked if I could transfer back. I was told it was at least 90 days out to get an appointment. That's not right. And that is because they're splitting the nurse practitioner who's now here because Dr. Bateman wasn't doing his job. Now they're splitting her. She gets like 2 or 3 days in Lamar and 2 or 3 days here. And that's just not enough. They promised to keep the clinics in Lamar, Burlington, and La Junta fully staffed whenever they close down the VA clinic. And so that's all I have. If you guys have any questions of me?
Well, I just say, Jody, I'm not a veteran, but most of my family is, and I'm a proud American. And whatever we can do for the veterans, we'll do everything I know the 3 of us can do.
I know you get my phone calls regularly.
Yes, it's A-okay. I'm always happy to see your name. It's okay.
Any other questions?
Fully support the veterans.
Yeah.
Are there any other questions of me? All right, thank you for letting me have my 3 minutes of fame.
You betcha.
Thanks, Jody.
Thank you. Resolution 2022-07, opposing the closure of the La Junta VA clinic. Amy, if you would.
I'll be happy to. I want to say really quick to the media as Commissioner, what's his name, Baldwin? what just said 7, I looked and there is a typo on page 1, so we'll be replacing page 1. Because this is number 7, not number 6. So is it alright if I just read it through? It's pretty self-explanatory instead of doing a summary.
Right.
That sound good?
You bet.
This resolution is to oppose the closure of the La Junta VA clinic. Whereas on March 23, 2022, the notice of the Department of Veterans Affairs recommended modernization or realignment of Veterans Health Administration facilities and recommended closure of the La Junta VA clinic by 2026. And whereas the VA is accepting public comments until January 30th, 2023, and whereas the VA will be making a determination by February 15th, 2023, and whereas no matter where a veteran chooses to live and puts down roots, the VA should be available. And whereas our veterans all sacrifice together to keep us safe, and we should come together to keep their health safe. And whereas VA closures send the wrong message to our youth that are interested in a career in the military. And whereas VA closures decimate the morale of our veterans. And whereas rural veterans play a vital role in the health and well-being of our small communities. And whereas there are currently a majority of eligible veterans in the service area who use the La Junta VA clinic, which is located at 1100 Carson Avenue, office number 204 in La Junta, Colorado. You'll get page 2. Whereas the closure of the La Junta VA clinic will have a negative effect on the veterans who live in Otero County, and whereas rural healthcare facilities would not be able to absorb the veteran population due to the shortage of medical staff. Whereas there are associated problems with veterans using private healthcare facilities, which could cause a financial hardship for the veteran. And whereas our aging veteran population would have difficulty making the long and expensive trip to Pueblo, Colorado Springs, and or Denver. And whereas the wait times to access healthcare at the out-of-county facilities is expected to increase. And whereas the rural areas lack adequate broadband access to utilize telehealth. And whereas the closure of the La Junta VA clinic will have an adverse economic impact in Otero County. Be it resolved by the County of Otero as follows. The County of Otero opposes the closure of the La Junta VA clinic. The County of Otero requests all eligible veterans who have DD 214 to immediately enroll in the La Junta VA clinic. The County of Otero implores all elected leaders from southeastern Colorado to send their written comments to the VA to support the La Junta VA clinic. And number 4, the County of Otero concludes our veteran population must have face-to-face local medical appointments available in La Junta.
Excellent. Thank you, Amy.
You're welcome.
Very good.
Any questions or comments? Hearing none.
I move to approve the resolution 2022-07 opposing the closure of the La Junta VA clinic.
And I will second that.
Okay, we have a motion and a second. All of those in favor say aye.
Aye.
Opposed? Motion carries.
I'm gonna be real brief because I've only been in the position about 6 weeks now, so just wanna let the commissioners know approximately that I have 890 veterans that are enrolled, or have applied for benefits at some point in the past, so I've got 890 enrolled in the office. Since March 15th, the office has filed 34 claims, and those claims are for disability benefits, pension, dependency, compensation things, so the various forms of compensation we receive from the, or paid for out by the VA, the veterans or their families. I want to thank you for passing the resolution supporting keeping the clinics and things open here, and I'll go into that just a little bit more right now. Senator Manchin from West Virginia released a statement at the end of June that he is not going to hold hearings on the nominees for the Air Commission. So with the Air Commission not being, those hearings not being held and those members not being confirmed by the Senate, the Air Commission recommendations die on the vine. They don't go anywhere. I'm still waiting for some other information to come in from the Veterans Administration themselves. The Secretary of the Veterans Administration has made a few comments about, possible actions he may order the different regions to take on their own, but, I haven't seen anything in writing on that, so that's what I'm waiting on. And I've reached out to my contacts with the Veterans Administration Public Relations Office to let me know when that may be forthcoming. And as soon as I have that, I will share that out. Yes.
Could you please, since, we have two non-veterans on our, county commissioners board, could you please explain to them, that not on, all of the ins and outs, but not only do you have to be honorably discharged, but you have to be disabled and meet the means test in order to receive health care?
Sure, yeah, for healthcare, to enroll in VA healthcare, one was pointed out, you have to have something other than dishonorable discharge. So honorable, a general under all honorable conditions, and honorable, and administrative with honorable conditions to be enrolled in healthcare. There is a means test that, you have to have a certain level of income, or you can't exceed a certain level of income to qualify for Veterans Administration healthcare. Or if you have a service-connected disability, you can get healthcare related to those disabilities. So there is a multi-layer system in order to qualify. Just because you're a veteran doesn't necessarily
Make
mean
you
you're gonna
qualify.
qualify, right? It goes the same with educational benefits. They're a little more cut and dry.
Yeah.
If you have anything less than an honorable discharge, you will not qualify for education benefits. Which is, I think, something some people don't realize. I've had some veterans come in wanting to apply for it, and unfortunately, they didn't qualify because of their type of discharge.
And with home loans, probably the same.
Home loans, you have to have an honorable.
Yeah.
So, it falls more in line with the healthcare requirements for the home loans.
One other thing, explain to them about National Guard, please.
Okay, yeah, the National Guard, may not qualify unless they were called up on what we call Title 10 orders. If they're called up on federal orders, they would qualify as long as they served the term of their time on active duty. It could be 30 days, it could be 2 years, but they have to be federally called up to active duty to qualify for that. So, let's say we have a National Guard member here that was called up to help fight some of the wildfires here, a couple of years ago. That's called up under state orders, which would not qualify them for the federal benefits. Now, there is an exception to that. If they are injured on active duty training, or they're training on weekends, and that's documented, then they would qualify.
So this is nothing new, right, Rick? This is,
No.
something's been going
It's
on.
always been this
It's
way.
always been that way the
Yeah.
whole time, remember?
The National Guard gets a little tricky with what they qualify for, or
Sure.
don't qualify for, so. To address something you said earlier, the Eastern Colorado Healthcare, they're doing a community meeting down here on August 10th in La Habra. This is not gonna be like the meetings they've had in the past where it's about an hour and we meet in this room and it's somewhat limited in the people that are invited. This one is gonna start, tentatively at 2:30 in the afternoon and go till 6:30 that evening. The first 3 hours, they're bringing down staff to meet with veterans one-on-one, either to help them enroll in healthcare or answer any questions they have concerning their healthcare. And that includes, the community care referrals, which I know don't always work as smoothly as they should. And not only is it somewhat not very timely in getting those referrals and getting those appointments, on the backside of it, I've had to deal with the billing. The veterans themselves are getting billed versus those bills being sent to the Veterans Administration and TriWestern contractor for payment.
Now, Rick, isn't it illegal to actually, for them to send the bill to the veteran?
Yeah, it's supposed to be, but it still happens, and that's a conversation I have with those providers when they do that, especially when they continually bill the veterans. I've dropped that card on them more than once, if they did not cease and desist billing the veteran directly, I was gonna be turning it over to the Veterans Administration Office of Office of Inspector General for, investigation. And that's usually, they usually wake up at that point and it takes care of that situation.
Good.
I don't know where that meeting is gonna be held at, because obviously this room is not gonna be large enough, and so I'm exploring a couple of different options within Lahana where we can host those meetings and have the room set up for those one-on-one conversations, and offer the veterans some privacy while doing that. And then from 5:30 to 6:30, it will be Director Gilmer, the Director of Eastern Colorado Healthcare, holding that open forum meeting, to answer questions, update us on where we are at with the Air Commission, what steps the Secretary of the Veterans Affairs may be taking to address those needs and things. I've been working with the Public Relations for Eastern Colorado Healthcare on getting that advertised throughout the area from all of Otero County and all of Bent County. So we're looking at radio, online media. Yep, we've already talked about you will be reaching out to you, Dustin, directly.
Thank you.
So, yep. And we're also gonna try to get a radio spot in on the local radio station the week before. I think I've got it arranged for Director Kilmer's going to call in that morning to talk about it, and then I will go out, and be live.
Very good.
Right. And it's going well, thank you again, and, I appreciate all the support and things, so.
Thank you.
Thank you for what you're doing.
Are there any questions?
You do a good job.
Not at this time. You have any questions?
Good, thank you.
Really appreciate you
I have one-
working
I have
for
one-
us
I have a
and take
question.
care of our.
Yes.
You'd mentioned 890 enrolled, that's what you said?
Yes.
So, I'm guessing there's more, right?
Yes,
that you-
there are actually over 1,000 veterans within Otero County. I don't have the exact number, I did look at the latest GDX before I came in.
Yeah, no, I'm just wondering, is there active recruiting? How do we get those involved to be a
It's
better?
a lot of it's kind of word of mouth,
Is
and
it?
I've been going to some of the, I've been to the, American Legion Post meetings here. I have it in my schedule to get to the other communities, to their American Legion Post or VFW Post or whatever posts or outlets that are there for me.
Okay, I just
to
wasn't
do
sure
this, yeah.
if, how we were, because the bigger footprint we have, the
Oh,
better, of
exactly.
course you know that, but I just
Yeah.
wanted to make sure.
And, I have plans to try to do something at the, Otero County Fair in Rocky Ford and set up a table there at least one day.
Yeah.
Just to get the word out and things, and the radio station spots and the upcoming community meeting will certainly help with that too.
Yeah, great, thank you.
Yep.
Thank you.
Any